On July 20th, 2020, a month earlier than usual, the Klamath Basin National Wildlife Refuge Complex brought in their first case of avian botulism. As of Friday, August 21st, over 15,000 birds with botulism have been retrieved. This conservatively represents half of the birds estimated to have been lost in the wetland to date. A daily average of 500 birds, with several days more frequently exceeding 1,000, are being collected by biological staff. The Refuge, their support team from Bird Ally X, and the birds of the Klamath Basin need our help. Botulism is a common occurrence in the Klamath Basin and throughout the West. The severity of these outbreaks is driven by numerous environmental factors. Things such as weather are out of our control, and others such as timing and availability of water are dictated by climate, prioritization of use, and competing demands. This year, those factors converged in the worst possible configuration at Tule Lake National Wildlife Refuge. Compounding the problem are prolonged hot conditions that set the stage for avian botulism to spread. Molting mallards appear to be the most impacted waterfowl, along with cinnamon teal, green-winged teal, and gadwall, also experiencing dramatic losses. Over the last week, the refuge has seen a large influx of early migrants, especially shorebirds. Daily collection of western sandpipers between 500 to 800 birds, along with high numbers of American avocets, black-necked stilts, and long-billed dowitchers. The refuge's botulism rehabilitation hospital has been up and running since July 15th, with daily critical support from the nonprofit entity Bird Ally X. As of Friday, August 21st, 1,495 birds have been admitted to the hospital, and admittance has been averaging around 50 to 100 birds a day. The hospital is running out of room to house patients. Additional pools and holding pens have been fabricated, but the hospital is struggling with limited capacity to bring on support staff required for quality care, daily cleanup, and the management of the facility. Currently, they are managing with just 5 people working at least 10 hours a day. By comparison, in 2019, they treated 233 birds and had over 17 volunteers throughout the season. This struggle is complicated to fix with volunteers, considering COVID precautions. Despite the challenges they are facing, the hospital data suggests that if birds can survive the first 24 hours after being removed from the impacted environment, that their success rate of returning back to the wild is 90%. The Friends of Malheur National Wildlife Refuge are asking you, our friends and supporters, to help us help the birds of the Klamath Basin National Wildlife Refuge Complex. We will be sending a grant of $4,000 to Bird Ally X. This will pay for 2 full-time duck hospital interns from now to October 1st. These interns will be critical to the survival of the birds. Please, make a donation to support this work now. Thank you.